Government says it is mobilizing resources to respond to the outbreak of diphtheria through early case detection, containing the spread, preventing further transmission, and escalating routine immunization and vaccination in states. According to the federal government, it is doing this through the National Primary Healthcare Development Agency, the Nigeria Center for Disease Control and Prevention, and other partners, following concerns over the expansion of the outbreak in the country to newer states. Here's that report.
The disease, which has been declared an outbreak in Nigeria since May 2022, is now a cause for more worry, as 836 of the cases have been confirmed in 33 local government areas across 8 states in the country as of July 27, 2023, with suboptimal vaccination coverage said to be responsible for outbreaks. According to the National Primary Healthcare Development Agency, a total of 83 persons have died of diphtheria out of an estimated 2,455 suspected cases reported in 26 states within 15 months in Nigeria.
Unfortunately, there are still children who are unvaccinated despite the availability of free vaccines in the country's routine immunization schedule.
With adequate vaccination coverage, we could have avoided this, and most of them, from data that we have, 22% of the confirmed cases were only immunized. The rest were not vaccinated.
So to us, it's clear that the COVID pandemic affected the speed that MPHCA was having to really increase the coverage. Coverage increased, but still we are missing the zero-dose children.
To facilitate immediate response to the outbreak, a multi-phase strategy will be carried out in 2 phases encompassing 25 LGAs across 4 states, 171 LGAs across 6 states, and targeted outbreak response in LGAs across 8 states.
We are leveraging surveillance data from the NCDC, direct information from the states to ensure effective planning and resource deployment. The agency is working closely with partners to ensure adequate supplies of tetanus TD for those children between 4 to 14 years and pentavalent vaccines for children under 4 years.
Establish National Diphtheria Technical Working Group that use one health approach and that engages all the partners and MDAs. And then we have also supported the states where they have had outbreak to establish incident management system. And we've supported development of capacity for the laboratories in these states to be able to confirm diphtheria, to make response faster, closer to the states, make it more effective.
The antibiotics being used currently to treat diphtheria cases have shown that there is some resistance of the Corynebacterium diphtheria to the antibiotic. So it's also part of the reason why we are seeing high mortality in some of the locations. As of today, 1,800 vials of diphtheria antitoxin is expected to arrive in country on 2nd of August, and erythromycin to follow in the next 1 or 2 weeks.
Health authorities say despite efforts by the federal government to provide safe and cost-effective vaccines, a significant number of children between 2 to 14 years remain unvaccinated or partially vaccinated, compromising the country's goal of achieving population immunity. Aisha Salihu, Trust TV News, Abuja.